Lucy Garcia, the matriarch of the Garcia family, died at the age of 72, and the autopsy reports that she died of sepsis due to the complication of her pressure wounds. And that's the topic for today's video. As a nurse, we saw a lot of patients, mostly that came from nursing homes that already had pressure ulcers. I wanted to do this video and give you some highlights and information about nursing homes, as well as what a wound pressure is and how to prevent them. The main way to prevent them is you must turn patients to different positions every 2 hours. That's what the literature or the studies say. If you're sitting on one area of your body, eventually the pressure diminishes the blood flow around that area. There are several stages of these wound pressures. In Mrs. Garcia's case, her wound pressure was considered stage 4. And stage 4 is the highest level. When that happens, you are more prone to infections. And if you have an infection, a lot of times a bacterial infection, it may get into your bloodstream. And that's where things happen for the worse. If an infection goes into your bloodstream, the result is that you have something called sepsis. The end result of this sepsis, your internal organs start shutting down, and you're in essentially a spiral. Once you get to that point, a lot of times there is no recovering from that. If you have sepsis and you're elderly and you're compromised and you have other disease processes, it's even harder for the medical staff to get you out of that state. So let's go over the stages of these pressure wounds. Stage 1 is the beginning stage where you'll see some redness. And usually when you turn your patients and have them move, meaning if you get them out, have them walking or sitting on a chair, that small movement from going from bed to chair adds to their mobility. Stage 1, many of us would get that for sitting in long duration on a chair or one stationary position when we're sleeping. Stage 2 is when you notice some blistering as well as possibly a skin break. And I have this picture to show you the various stages. And the third is when you see a definite break on the skin, you might see some tissue that's underneath the skin. Stage 4 is when you are downward in the muscles. Many of the patients that came from nursing homes had stage 3 or 4. Most of these pressure wounds occur in what we call bony prominences, where there is a bone that kind of sticks out, whether it's your elbow, because patients are laying down. You'll have ulcers on their sacrum, which is bone on top of your tailbone. They could also develop in the heels. In hospitals, you'll see a lot of nurses or other healthcare providers will prop pillows underneath the calves so that the heels are elevated. It's pretty routine that if you have a patient that is bedridden, that you do turn your patients every 2 hours. If, as a reminder to nurses and other healthcare providers, will actually put a sign by the patient's door to remind the staff that this particular patient needs to be turned. Hospitals can manage that a little bit better because their staff ratio is a lot better. However, in nursing homes, it's not uncommon for staff to have upwards of 10 patients or more that they're seeing. So if they're doing other things, it's nearly impossible to turn your patients every 2 hours. And this is not just a problem with this particular nursing home. This is a nationwide staffing issue. In the field of nursing, we have nurses that specialize in what we call wound care. A lot of times you have these wound nurses come and assess, they help with cleaning, they help with putting antibiotics, with dressing and redressing the wounds. That's how it's in the hospitals, and I don't know how that's entailed in terms of the nursing home. Maybe the nurses that are working in the nursing homes could pipe in and put that in the comment section, because that would help the listeners in terms of what's being done in the nursing homes. In the case of Mrs. Garcia, the autopsy report states the neglect of the caregivers, which led to her wound ulcers or bed pressure ulcers that led to an infection that got into her bloodstream. This is very interesting because in many cases it's very difficult to connect whether the sepsis is related to that wound or something else. But in this case for the autopsy report, that was what the coroner found. Most of the time there's documentations of how many times the patients are turned. Now, as an emergency room nurse and ICU nurse, when we receive patients, one of the things is that we do a head-to-toe assessment. And a lot of times when we saw patients from nursing homes or assisted living, we would document any pressure wounds and document what stage those pressure wounds were. In many cases, these patients with wound ulcers would come in because of some issues related to infection. It doesn't surprise me that this news got into the mainstream. There's going to be a lot more people in this situation where you need to put your parents or your spouse, someone who cannot take care of themselves. My parents, especially my dad, who is up in that age and who has developed early stages of dementia, has told us that he does not want to go into a nursing home. Like everyone else, you hear horror stories about being in a nursing home. And one other fact is that in nursing homes, you're not going to have the ratio of registered nurse taking care of, let's say, 4 or 5 patients. There may be one registered nurse that's assigned to a particular floor or unit of the nursing home. So your level of care is not going to be the same standard as if you were in a hospital setting. So that's one of the disadvantages of being in a nursing home. As a family member, we really don't know how our parents or spouses, whoever loved one we have in those facilities, how are they being taken care of? To be honest, I think nursing homes have to be revamped because this is not the first occurrence. In my experience, when I receive patients from nursing homes, they tend to be the worst case in terms of how they have been taken care of. There are patients in nursing homes that we have assessed that have multiple pressure wounds. This is not a problem for that particular nursing home place in Ohio that took care of Mrs. Garcia. It is a nationwide problem that needs to be addressed, but there's no funds for it because I think people don't realize how bad it is and how challenging it is for the staff to take care of the number of people that they have responsibility for.